really fortunate to have Karen Lecomte from the adult hospital that she runs. She is the CNS, clinical nurse specialist for the Patch Clinic. So that's our congenital heart patients that leave children's, and 50% of them go directly to her and her team. And she's going to share with her the adult perspective of what they needed, that they feel they need around transition, and things that they're working on. So we grabbed her literally just before Christmas, and she kindly put together a presentation for us in like 24 hours. So welcome, Karen.
Oh, thank you. And I have to say thank you to Mary, because she actually created some of these slides for me. So thank you for your help in preparing this presentation. So as Mary said, I'm the clinical nurse specialist for the Adult Congenital Heart Program at St. Paul's here in Vancouver. And I saw Adrian on the line, so I know I'm not the only one with a congenital heart experience on this call. Our clinic is the provincial resource for British Columbia for adults with congenital heart disease. My other confession is most of my background is pediatrics. I spent 24 years in pediatrics, and so I'm kind of new to this adult stuff. So I'm going to give you an overview of some of the work that's being done in British Columbia and kind of future endeavors. So my next slide there. Thank you, Lisa, for doing my slides too. Can we go to the next one? Okay. So I want to thank Mary for this slide, as it really helps us to visualize the complexity in preparing youth to transition and transfer to adult care, and why we, those of us who are working in adult care, need to put some thoughtful consideration to how we can improve our systems and processes to meet the needs of transitioning youth. And so you can go to the next slide, Lisa. I wanted to give you a little bit of background to our congenital heart disease world. So, and these are just some basics for you, and explain some of the complexity that we see in our congenital heart world. So many of the advances within congenital heart disease has resulted in an exponential growth in this patient population. And for the first time in history, in the last several years, we've seen more adults than children with congenital heart disease. And this population is exploding. Not only is there a silver tsunami happening in Canada, there's also a tsunami of congenital heart disease patients that we're going to see more and more of in the future. This population of congenital heart disease survivors have complex needs, and they require very specialized care. They're at risk of substantial morbidity and mortality, especially in the early to mid-adult years, is what the literature indicates and what we see a lot of. And it's becoming an important burden in the healthcare system that we need to address. There's also a misconception out there that these children or these youth that are now entering adult healthcare systems have been fixed or cured. And as we understand the trajectory of many of these heart conditions, we know that that's not necessarily the case, and that they do need regular health surveillance, they need support, and they continue to need medical and surgical interventions. Sorry. And you can go to the next slide, Lisa. So I like to show this picture because, again, it's just a really good visual of where we've come in the last, 70 years, where we've been better able to diagnose congenital heart disease early with advances in fetal diagnosis. There's been huge advances in neonatal and pediatric care. My background is actually pediatric critical care, and the stability and the surgical outcomes over my career of 20 years there has just been phenomenal. Like it's really amazing to see those changes. And of course, those improvements in childhood care and pediatric care have really improved the early survival and midterm survival, and now we're seeing a lot more late survivors of children who've become adults with congenital heart disease. And you can go to the next slide. And again, this is another visual that just shows you that tsunami, that big wave of patients that are coming our way. And it indicates some of the important surgical interventions that have happened since about the 1950s that have improved the outcomes and long-term survival of this patient population. And I have one more slide that will give you a visual. And so this, you can see, with this slide, you can see the trends of survival rates. So the survival rate for complex defects has gone from 10% to over 90% since 1940 to 1990. And so this is a significant patient population for us in the adult world. And so that's, I hope that gives you some context of the patient population that we care for. And this next slide, so being a transition interest group, I'm sure you're familiar with this slide or one that looks fairly similar. There's many differences between pediatric and adult care. And from my perspective, I'm really happy to say that things are changing in the adult world. There's an embracing of family-centered care and other initiatives that I think that are going to make the groundwork for transition and transfer much better for youth with chronic health issues. In the province of British Columbia, there's multiple initiatives underway to improve the transition and transfer of youth from pediatric to adult care. And I'm happy to say that we worked in collaboration with some of these groups, but this has been long-standing work that's been going on. And really, they all speared from the OnTrack program. And the OnTrack focuses on 4 key domains: preparing youth and families with skills to function in the adult system, supporting healthcare providers through clinical guidelines, training tools, and online resources, defining the role of community-based primary care family physicians, and providing continuity of care, and then defining appropriate referral pathways and care requirements for youth with complex health conditions, because many of those gaps are system-wide, and so addressing those are really going to support both the youth and the healthcare providers in achieving the best outcomes for patient populations with chronic health issues. And you can go to the next slide. So this slide is from Mary as well. And so it has the aim statement of the OnTrack program that we have here in British Columbia, and that is to ensure successful planning, preparation, transfer, and attachment to the youth with chronic health conditions and or disabilities from pediatric care to adult care with attachment to primary care and specialist services. So having said that, I'm going to talk a little bit about some of the initiatives that have happened in British Columbia and how we've been involved in the adult congenital heart world. All right, you can go to my next slide. And so this explains the pathway for transition, transfer, and attachment of youth. So you can see from this map that it starts when the youth is 12 years old, and we're carrying on into their early 20s from the adult end of the spectrum. So much of the work is done from 12 to 18 in the pediatric health care center, and then they're transferred or transitioned and transferred onto us in adult care. And I'm going to explain some of the initiatives that have been happening in our province with that. So the first one, if you can go to the next slide, Lisa. Thank you. Our transition clinical pathways, and this really has come from the pediatric groups. They're developed through BC Children's Hospital, and they guide the preparation of youth and documents their readiness to manage their care in the adult care setting. The transition clinical pathway is provided to the adult specialists, community-based family practitioners at the time of transfer, and it lists the cardiac-specific tests and reports and highlights areas where additional education and support is required to help the youth acquire the knowledge and the skills that they'll need for self-management. So this is, you can see that there's draft watermarked across this document. So we're just starting to see these in our clinic. And usually it's that middle column that's filled in is the transfer, because they've just been doing some PDSA cycles refining this tool. So it's so far it's been really helpful to have this kind of information, and in the future we anticipate to be able to better utilize it and use a column that has adult care there. The next tool is the OnTrack website, again developed, well, this is actually Mary's project, so she's probably a better person to talk about this, but it's the tools for the youth and family. And what you're seeing on the screen is a screenshot of the OnTrack website, and you can access that by the domain you see at the top of the slide there. This website houses toolboxes developed by and for youth and families to help them navigate and develop the skills required for an effective transition into adulthood and into the adult healthcare system. And there's so many tools. It's just an amazing resource. There's videos, there's self-directed activities, there's tests, and these are all aimed at developing self-advocacy and self-management skills, aimed at peer support. There's information on educational, vocational, and financial planning, sexual health, and healthy lifestyle choices. And then there's a family toolbox that provides guidance for youth who will always require additional support for things like housing, finances, personal care, and or guardianship. So this is an excellent resource available in our province. Actually, I'm sure it's available across the country because it's web-based. If you go to the next slide, this is another tool. Communication is a challenge in every organization. I feel quite confident in saying that. And this has really been developed to address the gaps in the handover, the information. So it is, in our province, we call this the medical transfer summary. And for the cardiology patients, it's specific to cardiac conditions. This is a dictation template that the pediatric cardiologist will complete to form the final referral letter or the medical transfer letter. And it assures that continuing care providers and primary care providers receives a very comprehensive summary of the medical history, that they have a medication and immunization history. There is anticipatory guidance included, and a psychosocial history is provided. And so this medical transfer summary is given to primary care providers, it's given to the specialty clinics, and the youth will also get a copy of it upon transfer. And you can go to the next slide. This next tool that we wanted to highlight is just an amazing project that we've embarked upon. It has been a lot of work. And these are called transition care management plans. And this is a new name that was agreed upon across all specialties from long-term care plans. So these are cardiac condition specific, and they provide information to support community care providers to understand the care requirements of patients with congenital heart disease. It's kind of like a high-level summary. And included in this is background information. So the purpose of the transition care management plan, a description of the lesion, and recommendations for how healthcare providers can use this tool. It also delineates the role of the primary care provider and the adult congenital heart specialist. Within it, it outlines the potential risks associated with a specific lesion, health surveillance needs, clinical evaluation recommendations, the responsibility in managing medications, exercise, lifestyle considerations, sexual and reproductive health considerations, and non-cardiac surgery and procedures recommendations. So it's a pretty comprehensive tool, and in the testing phase have been really beneficial in helping primary healthcare providers understand what their role is in the care of this patient population. And you can go to my next slide. Oh, and so I wanted to talk about iHeartChange, and I feel a little bit fraudulent doing that because you have the maker of the website, Adrienne Kovacs, on your webinar here. So I just wanted to thank her for the opportunity to join in this initiative. And iHeartChange is really cardiac specific to youth and provides a lot of support information for youth with congenital heart disease. What I really like about it is it has youth-friendly language and lots of visuals, and it's really geared to this age group. So it was developed in Toronto by Adrienne and her team, and there was an invitation for other adult congenital healthcare teams across North America, including us in Vancouver, to join this initiative. The website is publicly available, and youth are able to obtain a transition certificate by visiting the various content buckets that you can see on this website. And if you just go to my next slide here. Can we go? Okay. And this is a screen snapshot from iHeartChange and the patch profile. So one of the big gaps that this has addressed for us is the request from youth that they be able to see the clinic prior to transferring to the patch clinic or the adult clinic. So my understanding is that previous efforts of open houses and coordinating pediatric and adult teams have not been successful in the past. So this has really helped us by having a bit of a virtual tour in which they can look at our clinic online, and they can obtain some basic clinic information, as well as they can see profiles of the healthcare team that works here. And these profiles are youth-friendly and kind of fun. And so those are the initiatives that we've been working on here in British Columbia, and future endeavors to further engage and attach our youth with our congenital heart disease program include better and earlier communication. I believe that we have a pretty good understanding of who we would assign cardiologists to as they sort of reach 16, 17, 18. So we've initiated some conversations with how we can better inform youth so that they know who they're being transferred to as far as the healthcare team. And we're looking at further engagement with our youth groups at BC Children's Hospital. I already have an opportunity to speak to them at an upcoming conference and kind of dialoguing with them about what the patch clinic is all about. And yeah, those are some of the things that we've been working on. And that's really all I have to say, and open it up to questions or further dialogue on this topic.
Thanks very much, Karen. That was great. Does anybody have any questions or comments for Karen?
It's Mary. I just wanted to say thank you so much, Karen, for putting together an excellent presentation. I think it really, this is where we're getting to. We've been talking about barriers and obstacles for years now, and now we're really starting to learn and share the strategies to overcome them. And a lot of them is exactly what you talked about, and I know you've been incredibly influential from the adult world, as your team has been as well, in developing all the tools that you've shared with us today. And especially with your transition care management plans, and Susan Rabinovich is on the line now. She's the project manager for that. And I just wanted to say thank you, because it is really excellent work, and it's about that sitting across the table and having those dialogues with the adult world and streamlining some of the some of the really simple things that we talked about, which was one of the barricade you said that families needed or youth wanted to be able to identify who their adult care provider was going to be, not just a clinic, but who was their actual doctor, and that space between when they're actually transferred out of clinic, who are they assigned to in the adult world. So thank you so much for your presentation.
Oh, well, thank you for being such a strong leader in this initiative, too.
Okay. Do people have questions? And Adrian's on the call, too, if anybody wanted to talk about the iHeart.
Karen did a perfect job explaining it.
Okay.
Yeah.
Have you done evaluation of it?
We did a pilot study. So for a year, we actually did it as a study where we invited all patients transferring from pediatric to adult care, and we had about a third of the patients take part in the study, which is actually quite a good response rate for this kind of thing. We know that the use, so these were mostly 17-and-a-half-year-olds. They rated the components of the website very highly, so they thought it had useful information, was trustworthy, looked good, prepared them for adult care. So we had good feedback when we asked them to fill in feedback surveys. We also looked at where they went on the website, and so we have 6 main areas of content buckets, and they went to all the different areas of the website. The one that was slightly most commonly viewed was a section on lifestyle information, which just highlights the fact that the needs of these transitioning patients goes beyond traditional cardiac or medical care. So we're in the process of writing it up now, but we thought that the initial feedback was quite positive, and some people encouraged us to pursue like a randomized controlled trial to evaluate it, but we kind of thought the clinical utility trumped that, so that's why we chose the avenue we went. Yeah.
Thank you.
Adrian, what's the website address for that?
It's iHeartChange.org, so all one word,
Okay.
iHeartChange.org. And people do still create their own login ID and password, and that's because we are continuing. So there's a 5-item survey, so we figure out who's using the website. Well, that way they can also save their information because they have the ability to go through the website, answer questions, and they can generate a transition certificate. So this way they can save their information about where they go to. There's also a way for them to save a list of questions that they want to take to the doctor's appointment, so that's why we asked them to create login ID. That way we can also figure out who's going to the website. So although we're targeting transitioning patients, it's a publicly available website. So we might find that a lot of parents are using this website, in which case that's where we'd want to ramp up the next version.
Mm-hmm. I have another
Just
question.
one more comment on how to access it. I've had a lot of people say they can't get to it by Googling it. It actually has a secure server. It's HTTPS. Right?
Oh, there you go. Okay.
www. So if you're having issues accessing it, that's why.
Okay.
Learned that one by trial and error.
Oh, dear.
And I did notice on the screenshot that the Southern Alberta Adult Congenital Heart Clinic is involved. Do you know if the pediatric, this is Debbie Thule from the Adolescent Transition Program at the Children's Hospital, is the pediatric program here using that?
Sorry, where was that again, sorry?
The Children's Hospital in Calgary.
Yes, Calgary is one of, wait, are you talking about iHeart Change?
Yes, yeah.
Yes, Calgary is one of our partner centers.
Mm-hmm.
Right. Yeah, I noticed that the Adult Congenital Program.
So sorry, did you ask about adult or pediatric? Sorry.
I was asking about pediatrics, so.
We're relying on the Calgary folks to talk about it to the Calgary teams, both pediatric and adult. The one thing is it only went publicly available in December.
Okay.
But it's very new, so I don't know if they would have yet. And the other thing is, one of the things we have on the website is, for the first version, we had an animated tour of the normal heart, so we wanted to bring it down to a user-friendly way. For this version, we actually are having amazing graphic designer guy create animated tours of the 11 most common forms of congenital heart defects. That's taking a while to finalize, and we hope to have that done by the end of this month. And those videos will also be available on YouTube. So once that's done at the end of this month, we'll be publicizing it more widely.
Okay.
That's just the last. So the website is available, but I don't know if teams have publicized it to their partners and their colleagues just yet.
Yeah, they might be waiting for some of those things. Yeah, I'll follow up with Yvonne at
Yvonne
to find out what's happening here. But yeah, it's very exciting. I think that's very cool, and it looks like a fun, interactive way.
It's amazing. Yeah.
I think we hope it's fun for patients, but I will say it's been a really fun collaboration with people on the team. So it's rarely do you get to do something as a provider that's fun also, but this counts.
Yeah, that's great.
Thank you. Any more questions? Comments? Well, thank you, Karen. That was perfect timing. And now you can run to your patient rounds.
Great. Thank you, guys.
Thank you so much. And just so you know that the presentation was taped. I don't know if we didn't get your permission beforehand. And we put it in our Knowledge Exchange network. And I think, Lisa, is it when we send out, like for people that missed this call, because like you said, there was 20-something people that wanted to be on the call, can we send out a follow-up that gives people the direct link to the presentation?
Certainly, yeah.
Maybe that's what we'll start doing after the call. Well, we don't want people to miss the call, but maybe it's something we can start to do so that you can then, because this is a great presentation. It's great.
Yeah, it was very informative. Thank you, Karen.
No worries. I'm going to leave you guys now, and thank you for the opportunity. Bye now.